Go ahead, get started. Good evening, everybody. Welcome to McHenry County Board of Health regular meeting for March 16th, 2026. We'll call the meeting to order at 6:36 p.m. There was a little delay due to road conditions, getting a quorum here. We'll start with a roll call, please.
Ms. Althoff? Here. Ms. Carmen?
Here.
Ms. Hollyfield? Here. Mr. Clark?
Here.
Ms. Gaffney? Ms. Lawson? Here. Dr. Hedges?
Here.
Mr. Markison?
Here. There's sufficient members present to be a quorum and allow us to conduct business. Any public comment? Hearing and seeing none. Before we move on to minutes, we have a new board member present tonight. Dr. Irfan Hafiz has joined us as our medical doctor on the board. Would you care to introduce yourself? And then we will go around the room and do likewise.
Sure. Thank you very much. Thank you for having me and giving me this opportunity to participate, hoping to learn a lot along the way and hopefully contribute in some meaningful way. I've been in this, working in this county now, this is my 29th year out here, and I've been living in the county for now 10 years now as well. So, it's, being a part of the county is really important to me in that way, both professionally and personally as well. So I'm really just happy to be here.
What's your background in medical?
So I'm an infectious disease physician by training. I trained in Chicago, and at the time there was no infectious disease out in McHenry County. And my then employer, showed me a big map of northern Illinois. He had in his office, it was 8 feet tall on his wall, and I was still in training. I was looking for a job. There's a point to the story. And he said, we need you. We'd like you to work. And I said, where do you want me to go? He said, there's this place called McHenry County. And he had a 6-foot-long cue stick, and he pointed to the corner. And I said, I've never been there. I grew up in the western suburbs in Chicago and had never done that. So we took a road trip. We came out here. We got off on 31 and went back down on 47 because we went to McHenry and then Woodstock and then headed back. And there was nothing. There was all cornfields. We stopped for gas, and there was nothing as far as the eye could see back then. But I think we saw a lot of potential, and there was a lot of growth in the community, and we were excited to be here and see the county and the healthcare grow tremendously. What we have today compared to 30 years ago is night and day. I tell some of the younger docs that are coming on staff, they have no idea. They have no idea what it was when we started out here. And the services that we brought, we try to bring the hospitals from more community level, primary care driven to specialty, and now we're getting into subspecialty level care. And we want to continue to do that so people don't have to travel, they can get care close to home. So.
You had some first-hand experience here with McHenry County, correct?
So I've been, within a couple of years, the county reached out to me for the McHenry County tuberculosis program, and me being me, I'm like, I never say no. And so I did that for 25 years as the medical director for the county program for tuberculosis. And that was something also dear to me because as an infectious disease physician, it was a disease condition that was very impactful and that you could really make a big difference. So it was part of that, developing the practice. But for me, it was also joining the clinical hospital side to county public health. And to me, that was really that corridor to connect the two things there. And how does one policy and how does one involvement affect the other? So that was my interest in that. And continue to do it until I just couldn't do it anymore and pass the baton on to one of my colleagues. But I've been otherwise the only infectious disease physician out here till 2015, 2016, so it was just me.
Thank you for your service, like we said previously, and look forward to your experience coming onto the board here.
Thank you.
For the record, for the audio and visual record, board member Cindy Gaffney has joined the meeting. Pam, would you go next, please?
We have met as
We
we
have.
were interviewed on the committee, so it's lovely to see you here again. Pam Altoff, I serve as the board liaison to the Public Health Board. And I'm delighted to have you join us as part. And I'm from McHenry, and the population in 1970, again, I'm keeping the historian thing, in 1970, the population of the city of McHenry was 7,000. You can attest to that.
I can go back further.
And Jasper, it was only 2,000. So, yeah, it was tiny, little.
What is it now? You mean the town of McHenry?
Town of McHenry,
Oh,
city of
what is it
McHenry.
now?
Over 27,000.
27.
Yeah.
Yeah, it's huge, huge growth, yeah.
Yeah, lots of growth, but lots of potential, again, opportunity, so. And by the way, you didn't get tired, you just made room for a new person to
Yes.
move on. Just saying.
Succession planning.
Yes,
Glad to have you aboard.
thank you.
Which that's a duty we all have, to bring up the next
Yes.
generation.
Correct.
Sarah?
My name is Sarah. I'm currently a nurse over at Valley High, working in the long-term care and rehab. I've been there for 5 years. And before that, I did work around you as a CNA at Northwestern for 5 years, yep.
Matthew Twassel?
So yeah, we know each other, but I'm the medical director. It's my 4th year doing the job. I live in McHenry County. I work for Northwestern, as you know, in wound care. And I also moonlight out in Rockford at urgent care.
Cindy?
Cindy Gaffney, live in Marengo on Kishwaukee Valley Road. Retired, and I run an animal welfare organization on the side.
Carolyn?
Carolyn Lawson, and I've had the pleasure of working with
Yeah, I know
Dr.
you very well
Hoppus. And he got us through COVID. Oh my, you were amazing, amazing, so thank you. And I was so excited when they said Dr. Hoppus was coming into the committee. And I will go back, Pam, to 1955 when I was moved out here as a baby. And the cows went past our house and our mail was delivered on our pier on Muskogee Lake. So that's it, they came around with a boat and delivered our all all summer long.
Oh.
Yeah, so, and it has grown quite a bit.
Changed a lot in 15 years.
Mhm.
Kyle?
My name is Kyle Markson. I live in Crystal Lake with my wife and daughter. I'm a career firefighter, paramedic, now lieutenant, promoted. And I'm also one of our department's designated infectious control officers, so I might follow up with you at some point. So it's always fun to talk.
I do the check-ins with EMS and infectious disease. We've done that a couple of, we haven't done one in a while though.
I'm in Cook County, but
Okay.
then we have somebody else, but still, I always love to chat. Grateful to have you on the board.
Cecilia?
Hi, I'm Cecilia Carmen. I am a nurse. I used to work NICU, now I work from home. I work for Aetna, I do infertility. I've been on the board for like, I don't know, 3-4 years. And anything else? That's it. My husband used to work at Northwestern. I only did agency there, but it's a good place.
Defenders.
Oh yes, I'm part of the environmental defenders, the waste reduction team, so I like to bug Patty over there. And collaborate on things as well, so.
My name is Joe Clark. I reside on a farm in Marengo. My wife and 4 children were raised on the farm. Now have 3 grandchildren, one on the way. Thank you. I was a firefighter for 31 years, retired a few years back. I've been a farmer for 45 years or thereabouts. We raise sheep, cattle, corn, soybeans, hay, and been on board a few years.
Do we want to go this way, or do we want to go
For
backwards for the guest in the house?
Sure.
Hi, and welcome aboard, and thank you so much for joining the Board of Health. My name is Scott Hartman. I'm the county administrator. My job is I work with the 18 county board members and the county board chair to help them do the job they need to do. It's strategic planning, budgeting, administer day-to-day operations. I support our departments and offices to make sure they have what they need so they can do their job. So.
Thank you.
Melissa Adamson, Public Health Administrator.
Oh, my name is Brittany Montoya Castillo. I'm kind of new as well. I'm a specialist, I'm an administrative specialist. Darlene also, we work together, so you'll see me every so often. It's nice to meet you.
Nice to meet you.
You'll have to turn around because they don't have name tags on them this word. These are our main people here.
We met one-on-one, yeah. I'm Megan Heck.
Mary Ellen Howell, I'm the Director of Veterinary Health. You haven't been over to my facility yet, but hopefully you'll get to see it when we have our ribbon cutting or get a tour of it. And then
Is this in Crystal Lake?
Crystal Lake,
Yeah.
yes. And actually, I used to be the HIV coordinator 15 years ago, and I used to review all the standing orders from your office. A little connection.
Yes.
It's like
the
6 degrees of Dr.
Yes.
Patty Nolan, Director of Environmental Health. We had a nice chat about all things environmental.
Great. Director of Nursing, I met you before. I was born and raised in Woodstock, so I really appreciate what you did to expand care and to provide infectious disease services here. But I appreciated your story. Thank you for sharing and for your service to our community.
Thank you.
I got you. No.
You want a specific color?
I'm good. Well, thank you, everybody, for the introduction. Next item of business is minutes approval for the regular board meeting on February 9th, 2026.
I would like to make a motion to approve the minutes for the regular meeting on February 9th, 2026.
I'll second it.
A motion has been made by Ms. Carmen, seconded by Ms. Holyfield. Any discussion? Hearing and seeing none. Voice vote is good. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it, motion passed. Employee recognition. We have one employee we are recognizing this evening for 25 years of dedication to McHenry County Public Health. Angie Perez works with community health, and congratulations. That's quite a milestone, and don't see it very often, and we'd like to see more of it. Would you hear a statement, comment?
So Angie, she's been here almost as long as I've been here. And so I remember the day she started, she's the sweetest, was the quietest person, but she worked in the nursing division for years in CD, and she stayed in CD, and then she switched to community health once we kind of split divisions, and Lisa went to admin. Then Angie came to community health. She's amazing. She's smart. She's motivated. She's the most helpful employee you'll ever ask for. She will help anyone and everyone, and we are so lucky to have her.
Let's give her a round of applause. Next item on the agenda is department and division updates. Administrator Adamson.
So, nasty woman.
We're going low tonight. So on February 12th, so I've mentioned some of this before, but I'll just recap. On February 12th, IDPH received notification from Health and Human Services that previously awarded grants would be rescinded or terminated. So Illinois joined other states in suing the administration, and as a result of that, a federal court issued a TRO. The initial TRO was for 14 days and then later was extended to February 12th. So last Friday, the U.S. District Court for Northern District, Illinois issued a preliminary injunction that prohibits federal agencies from targeting Illinois, which includes all Illinois localities and instrumentalities with HHS and CDC funding cuts.
So IDPH will continue to monitor this and give us progress updates as the litigation progresses, but that's good news for now. Yes, ma'am.
It occurred to me, and I apologize, it occurred to me when we receive grants like that, and we know that we have a period of time in which to spend that grant down or have expenses, I think that we need to do, and I would like that to come to the board for the board just to be cognizant of what's going on. But I'd like to review the progress of those, you know, on like a 6-month, depending upon the length of the grant. But I think we should know where we are, because it occurs to me if we receive these grants and we have large sums of money and it's half gone and something like this happens, you know, we have a pot of money we didn't use. So I just think we need to be aware of it, not saying that every time you have to spend it down immediately, but I think it's a good thing for this board to get used to doing on a regular basis, just so that you are all aware of what.
Yeah, and this is a 4-year grant.
Right.
So it goes through December, well, actually November of 2027. So it's unusual both in its length, and it's a $350,000 grant that we got all that money up front. So that's where we do file reports, regular reports as a requirement to spend down that money and to show how we're spending it down. But when something like this happens, then suddenly we have a pot of money that would have to be returned, and we do have some expenses that are in the pipeline. So it does have a huge potential disruption. We don't have any staffing on this, so it doesn't impact personnel, but it does impact our ability to do things like large all-staff trainings. And in this case, some of the furniture for the reconstruction, you know, in the building is coming out of this grant.
Is our 60th anniversary training coming out of that? Do you know?
Yes, we're going to try to put that on this grant, yes.
So in a situation like this, where you say it's a 4-year grant, but it could be any timeline, and the money comes up front, if we spend that, or half of it, and they say, no, sorry, we have to give the whole.
Honestly, I don't know the answer to that. I think once it's.
No.
So if you spend half of it.
It's spent, it's
There's
gone.
half, we don't have
There's
half to
nothing.
return, so at least they're not, okay.
But if there's money remaining, I think is what you're saying, that that would be subject to being rescinded and the county would have to pay those funds back.
What are your
stop progress?
What are your thoughts about just including in the addendum for the meeting, just grants on a spreadsheet that would just pull up and you could quarterly cycle them or whatever?
Yeah, we can find what, you know, there's different ways that we could report out on the grants. I mean, technically that information is baked into that 5111, but you're not seeing all you wouldn't necessarily be able to tell what, if you're looking in the budget reports, the 5111 is all of our grants, but you wouldn't be able to tell because it's all rolled up together, whether it's the SIPA grant or our local health protection grants. So we can always break that out for you if.
And I would tell you this too, you could do that just at a finance committee meeting on a regular basis, and then whoever the finance chair is can come and say bye bye. You know, I just think it's wiser for all of us as board members to be much more aware of where we are financially if we ever have to make some very significant decisions with regard to the budget, right?
Yeah, the grants all do come in front of us on the monthly meetings, one at a time. So we don't record the totality of it. To have a rolling list of the status of the grants, yeah, that would be helpful.
Thank you, sorry.
Welcome.
Okay, and then you'll notice Anne is not with us tonight, so she provided an update for me. So on March 4th, we did a project management training, actually in this room. 2 rooms, just this room, with about 24 staff members. It was focused on developing clear and actionable project plans, setting timelines, and estimating costs. It was also a lot around communicating effectively with stakeholders. And the facilitator was really, really good, and we got a lot of positive feedback. So they might be somebody that we reach back out to in the future. And I think more than, we had mostly management in the room, but I think a lot of other staff could benefit as well from that kind of training. And then last Friday, I've lost track, 2 Fridays ago? 2 Fridays ago, okay. On March 6th, the department directors, we all sat down with MCC's Pathway program. That is their like career development, try to guide students around their educational and career paths. So we all got a chance to tell our individual stories. It wasn't a huge crowd, but I thought it was impactful, and I thought it was also great to hear everyone's stories of how they got to where they are today. And MCC was really excited, so hopefully there are going to be future opportunities working with them going forward. Maybe do it annually, we'll bring a group in, or maybe every other year. In terms of Crystal Lake, so we are getting very close. As a reminder, the ribbon cutting is on April 10th. The furniture for the animal control side was installed on the 10th, and they've moved back in for the most part. Yep, okay. The nursing division is going to move in tomorrow, so we're relocating the IVCCP program from the mental health board back into the clinic side. And the moving company will begin, they're going to start early tomorrow. So hopefully throughout the week, they're going to finish off those punch lists, any paint or dings, get that ready. So we'll be spick and span for our ribbon cutting and tours. And then you'll notice in the packet, there's a strategic plan update in the report section of the packet. So we're nearing the end of this particular plan. So we're looking at hiring a consultant to assist us with doing the next strategic plan that would go through 2029. So, and we hope to use SIPA funding for that as well.
Do we evaluate, do you evaluate the strategic plan and how much was accomplished?
Yeah, that's in, we're doing the report outs on where we've accomplished and what's still
pending. And that gets
pending.
rolled into the planning for next year.
Yeah, if there's anything outstanding or needs to continue.
There is a nice document in the appendix for this board meeting.
Light reading for me.
That's all I got.
Okay, Director Noel.
Okay, thank you. So in the last few weeks, I've been working with our staff supervisors to look at some of our internal processes and try to make some improvements, particularly on improving some educational efforts, because we've been involved in some files where it's just clear that in spite of the information that we put out there, that I think there's a disconnect on some of these things where we spend time on the other end of it, trying to explain things and say, I think we can do better. So we've identified a few program areas that we want to target: cottage food, property transfers, opening new food establishments and temporary food establishments. And I think with really some website enhancements and some internal process changes, I think we have an opportunity to really make some gains and some efficiencies and reduce some frustration on the part of our customers that are struggling with some of our processes, I think. Also to that end, we're in the process of doing some significant cross-training of our environmental health practitioners across all of our programs to ensure that, when we go out there, we can identify all of the relevant issues related to any property or any situation, efficiently and quickly, and move forward as best we can. I think it's better for them professionally. I think it's certainly an advantage to us as an organization, to have that flexibility. So we'll be working on those things, and I'll bring back, some information as we make progress.
Thank you. Any questions from the board? Director Howell?
Okay, a few items for you. We have hit our time where we're losing some staff. So we've got 2 going to other departments at the county. Good for them because they were good staff members. We've got 1 going to a city, making 1.5 times the amount. We are losing our kennel coordinator again. We are looking to figure out what we're going to do, because with 4 positions open, not 4 yet, but by the end of the month, 4 positions open. We really have to look at the priorities that we do, priority of our services. It doesn't help when you get, 120 cats in since maybe December. That doesn't help you, but, so we're working on that, and I think we'll be just fine with the turnover. It's just a matter of getting everybody seasoned again and understanding what they need to do. We do have our 3 clinics coming up. We're gonna work on some logistics in about 2 weeks, drive-through clinics over in Crystal Lake. We've got one May 19th, that's a Tuesday, that's a dog clinic. We've got one cat dog clinic, which is on a Saturday, the 30th of May. And then we've got another cat clinic on Tuesday, June 9th. Again, we're gonna work on the logistics of how we're gonna be handling those clinics going through our facility, going through either the side of the drive-through or using the drive-through. We're still working that out. We have seen a little uptick again in relinquish requests, specifically in military deployment. So we have some people who are going to be deployed who have to give up their animals. I want to say 3 dogs and a couple of cats coming together. But yeah, so we're feeling kind of sad about that. I have decided that if they have to relinquish their animal, we're not going to be charging them any fees for that. And of course, we would encourage them as veterans to adopt when they come back, because veterans can adopt an animal for free in the state of Illinois, so we would encourage that when they come back, because I think an animal really helps you debrief and kind of come down from stressful situations. We have been using Alliance for Humane Action, AHA. They do some of our cat spays and neuters that we can't put through our clinic. With that many cats coming in since December, we really have had to try to use some outside sources for some of our spay and neuters. And then the last thing was just what Melissa said. The office is back in the front office area. I think they really like it. It's a very open space. The officers are, not all of them, but 5 of them are in that officer area off of the lobby. And I think they really like that space. They actually have windows to look out now, so they're excited about that. The furniture, I forgot her name, the person with the furniture company came today. They need to make some adjustments. And we're moving back in. We're so excited about our new storage area. I know, but we have had a closet and a garage for storage for how many years? And now we actually have a space where we can declutter some of our other spaces, right? It does help with mental health, decluttering some of those areas. So we will feel a little lighter once we get our shelving in there.
And no matter how big you make storage, you will fill it up.
I know.
Just means you don't have enough storage. It's fine, it's more storage.
But compared to a closet, it's pretty good.
Can you share who's leaving? I mean, I don't know who they are.
I'll just say an officer is, actually we lost an officer to another department, she already left. We have another officer who's leaving for another department at the end of this month. And then we had an office person who went to one of the cities.
Is it one that's been there for a long time?
None of them have been there that long.
Okay. And the kennel coordinator?
The kennel coordinator, yes. That's at the end of this week. So, yeah. It's such a great position, but it's a struggle because it does do a lot of varying tasks. And so, and that's a lot of responsibility as a kennel coordinator. I mean, if we bring 1,000 animals in a year and you're figuring out the disposition for each one of those animals, you have a lot of help, but it's still a lot of work. So.
In regards to the vacancies, short term, would a temp service be helpful?
Well, I'm looking at a temp service mostly for the cleaning part of it, because some of our officers, they do some cleaning each day. They rotate through the cleaning, and then losing the kennel coordinator, they do some cleaning. So I'm going to look at a temp service for. I've actually contacted them already about cleaning, and then hopefully we're getting towards. We have a meeting in, I think it's the 30th, for our image entry for Chameleon. Remember, we approved that project last year. There were a bunch of little hiccups in there. Now I think we're just about to the point where end of March here, By end of April, we probably should be moving through smoothly. And we do have some money that we could keep on our temporary contractual person we have right now too, to kind of maybe fill in some gaps.
Okay, very good.
With the veterans that have to relinquish, is there any possibility like setting up like a foster program?
We don't have one ourselves, but we always encourage them to contact other rescues first.
Okay.
Right? We really want to be their last resort because we get so many animals in that we don't know their health status, we don't know their past, that we would rather have the veterans go with another rescue, which we have plenty of them in McHenry County, before they relinquish us.
Okay.
So, I know we did a foster through another rescue a few years ago for someone who was homeless.
Okay.
Go ahead, Kyle.
I'm glad you brought it up, the vacancies. I meant to ask during the admin portion of it, but notice that we have 4 listed for this month across the divisions. There's 7 openings right now. I know we're doing exit interviews when possible. Do we have an idea of primarily financial compensation, or is there anything else?
I don't have any updates for you right now on exit interviews for the Y. I think.
I mean, I will tell you that, all 3 of the office person, the 2 officers, they don't have to work weekends anymore.
Yeah.
Going to another department. And then for the officers, they don't have to work a nighttime.
Okay.
And some of them are staying within the county government. Right.
Yeah.
It's a lateral transfer.
But when you do have to work those nights and those weekends, it would be great if we could compensate them just a little bit more for that kind of thing.
Yeah, absolutely. Yeah, it's good to keep in mind. I just want to, again, we've gone through this for years about the wax and wane with vacancies, so I want to make sure we're keeping an eye on it.
Yeah, so HR, if something triggers in the exit interview, they will pass on that information, but I haven't been given anything. I can follow up with Suzanne and see if there's anything, like a trend or a pattern in particular, versus if it's just financial or promotional opportunities that don't currently exist within.
And forgive me, I didn't mean to insinuate in any way that any of it was due to a personnel issue or something like that, but I would like to know whatever it was. So if it continues to be, as I heard for the 7 years I think I've been here, it's financial, a large part is, but I just want to confirm that's what it is.
Well, just based on what Director Howell said. Work schedule.
And
lack
financial.
Of shift differential pay. Is 2 of the contributing factors.
Right. And she said 150% pay difference for
the one, yes, going to another agency.
Yeah, that makes sense.
It should be something we have a discussion about maybe at some point, a shift differential. We used to have that when we were under the union, and it has not been made.
Particularly if we're experiencing that movement often in those positions, which it sounds like we do periodically, right?
Goes back to what is it?
8 to 4:30 as opposed to 12 to 8:30.
I guess,
Yeah.
Does Valley High have shift differential?
Yeah, so
Goes back to what does it cost us to train somebody? What does it cost us to lose somebody? What does it cost, and if that difference is less than shift differential.
Yes, sir.
Okay,
Plus,
thank you.
We aren't as effective at providing service.
Of course.
When we have all these vacancies.
There's a spool up time for a new hire, there's everything. We lose the efficiency, we lose the momentum.
Any further questions, comments? Thank you. Director Hack?
So speaking of vacancies.
I didn't mean to point right at you.
Mine's good news. We actually filled our health educator position. She started last Monday. Excited to have her. Then we also, although they haven't started, so I don't want to jinx myself, but filled our breastfeeding peer counselor position, has been open for a little while, and our part-time nutritionist, which has been a very difficult position to fill. I think it's the part-time issue. But yeah, so she'll be starting the end of the month too. So we're really excited. So we'll be fully staffed after that. Then I was also going to piggyback on what Melissa said about Crystal Lake, just to let you guys know that WIC won't be going back to Crystal Lake until April, although IBCCP is going tomorrow. The reason for that is we have to schedule WIC appointments 3 months in advance. So we had to make a decision of when we wanted to return there, like months ago. So we just, based on, we didn't know construction was gonna be done, we chose April just to be safe. So starting in April, WIC will be back in Crystal Lake too. And then, speaking of WIC, we also completed our first official WIC mobile health clinic with Lindsay's staff. They were really great. Caitlin's a great mobile clinic supervisor. And it was really successful. All our clients showed up, and we actually got a new client who was waiting in the lobby. So that was great. So it was kind of an outreach and new client interaction, so it was good. Our 2 ER, emergency response health educators, so Trey Hunter and Matthew Robertson, completed their Illinois Professional Development Series through IEMA, so we're excited for them to do that. And then just the last thing is our chronic disease team during February did a bunch of activities for Heart Month. So they created newsletters that were distributed to all the employees. They held some community wellness screenings, and they also partnered with District 158 at their employee wellness screening and did BMI and blood pressure screenings there. So that's it for me.
Thank you. Director Durrett?
Question, sir?
Oh, sorry.
The library, you said, which library?
With the WIC one,
Yeah.
was Woodstock, right? Yeah.
Awesome. And you mentioned the vacancies. On those monthly, it still shows 2 environmental specialists and a WIC nutritionist. Was that one of the ones you
Yeah, the
mentioned?
WIC nutritionist.
That's the part-time one that you were
Yes.
struggling to fill and
Yes.
filled. Awesome.
Yeah.
Still.
And the breastfeeding per counselor was my other one. I don't know if that's on the.
No. So it's 2 administrative specialists still. Does that sound right?
One of them we're holding now.
Oh, right, that one. Yeah, we're holding that
So
one.
you're gonna see one that stays on here, and again, that's part of, as we evaluate whether or not we need to reallocate that position somewhere else.
Okay.
So the county, that was part of the discussions during the budget, you know, if we can hold off filling something
Sure.
while we evaluate it, that's what we're doing with the second one down.
Okay.
The first one is one that's getting filled
Okay.
on the list in terms of the position numbers.
Great, thank you.
Director Durrett?
So I guess I'll start with communicable disease first. I had talked with you last month about AGE outbreaks, which has continued to be an issue. The CD team has been very busy. The nurses have been trying to mitigate some outbreaks in particular areas. They've done a couple of infection control assessments in person. We went out with environmental health on one. So we're working on it, but it's still out in the community. We've posted information on our social media regarding AGE. We've put out information to the schools about AGE. We've put out information to our urgent cares and such, so in the long-term care facility. So we've done a lot of the media messaging and such to try to educate the public. Also, IDPH provided updated guidance for RSV on February 26th. RSV has remained elevated in Illinois, but it's also remained elevated here in our county. So they extended the time at which they recommend immunization efforts through the end of March, which is outside of the traditional season. And so we put that on our social media pages as well to remind parents and elderly that they should think about still getting vaccinated for RSV as the levels remain high. We also advise the public that there was a rise in influenza B. That's not uncommon. After you have a rise in influenza A, then you often see a rise in influenza B. That's what we're seeing now. Influenza B is increasing, but it appears that the rate of the increase has slowed, so that's positive. General respiratory illness is at a moderate level of transmission at this time. When we last met, there had not been any measles in Illinois, but after that last meeting, the first measles case was reported in Collinsville, which was in southern Illinois, it's close to St. Louis. And then on March 12th, we received notification from DeKalb County that they had their first measles case. For local residents who might be listening, for contact tracing purposes, they were at Walmart and at the post office there in DeKalb on March 2nd and March 9th. So it's good for our residents to know. I know that it's a bit of a distance, but We're still monitoring that locally. Obviously, that's a reportable illness. Thankfully, that has yet to be an issue for us here this year. Additional information, IBCCP, we discussed, is moving tomorrow and is closed tomorrow for services, but will be open then on Wednesday. We tried to put the meeting and messaging out we often get walk-ins. I would like to say that we had 77 enrollees in February, which is a very high number for us, which is good, and we're at over 50 already this month, so we will likely beat that number. We've seen an increase in breast cancer diagnoses, which is both discouraging and encouraging at the same time. I'll continue to report on that to you. They have just over 80 appointments scheduled for women to get their screenings, which is great. We want to keep seeing that. And then I attended a standard 5 foodborne training. We looked at our foodborne illness response. I went with a couple of Patty's staff, and so that was a really interesting and helpful discussion and seeing things that we have in place here and how we respond to foodborne reports and how we do our investigations and work closely together and communicate. Our communicable disease nurse, Jessica, went to the D300 and provided a presentation this month. And yes, I think we have one staff vacancy at this time. So I think we're doing all right. That's all I got.
I'm glad you touched on it, but in particular, I noticed that 6 breast cancers diagnosed seems like a high number.
We've consistently seen higher numbers in breast cancer diagnoses. Like I said, I'll continue to update you.
Probably better detection too.
Yeah, our numbers are up to.
I mean, I do find it a little bit disconcerting that you're having more diagnoses, but I can't say if it's screening or if is it just like, I'm not sure. I'd rather see that they're being screened and diagnosed than not, but at the same time, to see higher numbers is always, I think, a little bit disconcerting with regards to diagnoses.
On that topic, is there a KPI, a key performance indicator that we can tease out or some kind of additional information we could look at where it's like, what is the status of this, like the detection, like early detection, terminal detection, you know, what?
Sure, how serious are the diagnoses themselves?
I mean, we make this case, we just recently, I feel like we made this case in terms of funding about the good that we do, and I don't want to shy away from that light of like, these are lives potentially saved, and it's super important.
For sure, they do often get messages from women who have expressed that they feel that the team has saved their life, which is very moving, and a huge responsibility. The team has done an amazing job of supporting the women in our community, so I cannot speak highly enough of them.
Yeah, a couple of factors is, that there's more screening done and the screening is better, is that women can now self-refer to most places, breast diagnosis centers. And then also they do more of the 3D mammography, and there's a lot of automatically go to ultrasound, automatically go to MRI. They have the breast radiologist right there. So, yeah, it's just A, getting more into the system, and B, getting better detection. Yeah,
that's outstanding. And I don't want, I want to be very clear. I want to make sure that we are advertising in a way that is protective of their privacy.
Because there could be this hysteria, oh my God, there's more breast cancer, but there's not, that's something else, right?
For the last 12 years, I've served on a charity cancer group called the Pink Tie Ball. We've hosted in Schaumburg for the last 12 years. And I'm just amazed at how many people are touched by cancer, right? It's this huge thing, and I'm always shocked by who has and who hasn't been affected by it.
I think we are all interconnected, and that everyone can identify or know someone that was diagnosed with breast cancer or cancer in general, for sure.
So just to dovetail onto what we talked about with notifying the public and telling what we do here, right? I think this is a very valuable thing. So if any patients who we've referred or assisted in any way, if they are willing to provide an anonymized, this is what happened, this is a great outcome, or even just aggregate data that said, we found these breast cancers and these were the ones that this is a good catch, right? I mean, I would like that in some way, form, or fashion.
I do keep the thank yous and such, and we did put out a social media post specifically with permission.
Okay. Yeah.
For Breast Cancer Awareness Month, and that's kind of my hope to continue to put out messaging that does speak to the personal side of the diagnosis, so.
I'd like to be able to show that, you know, when possible, when protecting them.
For sure.
Carolyn?
Are we looking at men also and getting the word out to them?
Education, yes.
Because when a family member of ours found out she had breast cancer, the first thing she did was notify her brother and her cousins, because the guys don't think about it,
Right.
and it hits them too.
Mm-hmm. Yeah, one of my coworkers' fathers, you know, male breast cancer.
Regards to the RSV and influenza
Yes.
vaccinations, do we provide that to any of those that qualify in
We
this?
do. We provide RSV and the influenza.
Okay,
vaccine.
thank you. Anybody else?
I just have one question. You said with the increase of patients that we have, have you noticed it like maybe after like an outreach that there's more increases? Is there any kind of correlation with
They
that?
have been calling back previous enrollees, so
Okay.
hundreds of women have been contacted that they had previously to just, you're overdue,
Oh,
you
okay.
need services. So that's probably a portion of it, but they get a significant number of walk-ins as well.
Okay.
So I'm hopeful that they will now know that we're at 100 North Virginia Street.
Awesome.
If to board members, if you haven't already done so, put April 10th on your calendar to attend the open house for the ribbon cutting for the clinic. It's a moment of celebration. It's a good thing. And our presence, I think, would be appreciated by our staff. So try to make an attempt to get there.
I'll try and trade it.
Do we have names?
Just bring the engine out.
We are working.
Yeah, that was brought up.
We'll talk about
I just
She's gonna bring
it would
it
be
up.
nice if we're there, but it would also be nice if we were identified.
We had that discussion.
Yes, yeah. Right, yeah.
Dr. Tomaso?
Sure, so just gonna talk a little bit more about measles, what it's looking like so far this year, kind of nationwide, because that's gonna have implication on what is coming here, and it is coming. So the numbers this year are kind of on the grim side. So in 2026, more than 1,000 cases have been counted. 2026 is one of the 3 worst years since 2000 as far as the numbers. And then as far as last year, there's been 3 more times the number of cases this time last year. And 20 times the number of cases from 2024.
How does that coordinate with vaccine?
Yeah, the areas do. So yeah, it's continuing to spread as we see new positive tests come up all over. Currently, the epicenter's in South Carolina. I think this was a couple weeks old. So, and then 500 people in quarantine, hundreds infected in the state of South Carolina. And then, yeah, we do see the hotspots pop up where there is low vaccination rates. And Illinois tends to not be one because our state government is pretty strict about exemptions. And also, I think just in general, Midwesterners tend to just be kind of compliant folks, so we're thankful for that.
We're rule followers.
But there is an obvious link between the vaccination hesitation and just the vaccine was developed in 1963, and it's very effective and safe for measles. And then again, just some more kind of scary numbers. So last year, total there were 2,234 cases, which is the most since 1991. Measles was declared eliminated in the U.S. in 2000, which is going to go away. And then last year there were 3 deaths that were attributed to measles. Those are always going to be underestimated because there has to be a positive laboratory test. So every person that has a positive test gets reported to the health department, and then the health department tracks whether those or ended up being casualty. So the optimal time to test for measles is 1 to 3 days after the rash appears, and even within those 1 to 3 days, there could be falsely negative tests. And some clinicians just aren't gonna suspect it because, fever and rash in pediatrics is, very common. And, parents might not seek out care because they don't recognize it or they don't want, they just want their kid to just process the virus. So yeah, that would be far underestimated. And it doesn't go on a death certificate.
Do we, with the newsletters that we publish, do we send any information like that out? Like, what's it called? What's the newsletter that goes out? Bulletin, the bulletins that go out, do we publish that?
We have an internal newsletter for staff, and then we do stuff on social media, but we
Yeah,
don't
that's what I
have-
mean on social media. Is there anything, bulletins you can put on social media about that? I think it's important.
Yeah, we have cases in our.
I'll check with Nick, but we have, I don't think we've pushed out anything specific to measles. I mean, the state has, I need to double check.
Only reason I say, because it just enforces, good information. So it doesn't allow people to like, oh, well, no one's getting the measles, I don't want to give my kid a shot, kind of thing.
Well, we usually push out regular information on immunization as a whole and the importance of that. Can you think of I don't think
We haven't
pushed out
done,
a
we did
measles.
a measles post
Yeah.
last year. We have not done a measles post this year. The DeKalb County one is the closest one. She's not wrong. It's probably gearing up to be a bad season. I think that the people who have chosen not to vaccinate their children are gonna change their minds because it's coming. It was coming last year and they didn't do it. I don't mean that in a I'm
Sure.
not minimizing the
No.
importance of providing the information to people or in encouraging them to make an educated decision about that, to know what's happening and understand the implications of that. I'm not sure that they understand the far-reaching implications. I don't want to put out a scare tactic message. There are implications for babies, for long-term immune health. It's very scary. I think a lot of people don't know that, but I hate to, immunizations is already very hot button on social media. If you look at any immunizations posts that I've made or that we've put out, they usually get the gamut of responses. Not that that should keep us from putting them out, we try to be.
And providers also get the notifications that we get from IDPH, the sirens, to update them on whatever condition, if it's measles, and here's what you look for, when it presents or be on alert, you might start to see this and question X, Y, or Z disease and then test for it. So
I mean, I don't know
pretty
how much
regular.
traffic we get to the website, do we know how much traffic?
Oh, well, the web, yeah, we get a lot of.
So if we do, I think it could just be a generic pop-up. It could just list statistics. It doesn't have to direct people to do things. This is the latest update on the measles outbreak across the United States and in McHenry County. I think, that's informative, and it's apolitical, so it's just stats.
I think Director DeRade has a very valid point that, there is this sense of who's gonna get the vaccine and who's not gonna get the vaccine, and that it's all currency. You're building currency with some actions, you're spending it with others, and if we're sending out I agree that people should be notified, but it's also a cost in terms of the messaging. Because I know when I go to, there's certain websites where like my employer, you're getting just tons of email notifications. You're just like, all right, I'm not even looking at anything. There is a sense of fatigue with that, but I do think that DeKalb's not far.
Yeah, no, it is
And that
close.
is valid, and I think, as Dr. Tomaso mentioned, a lot of people don't understand how serious it is. The fatalities may not be high in terms of the global scale of them, but there will be children, and this long-term effects that we're seeing in regards to the immune system is not well understood, and I think there's reason to include that.
Yeah, I just think of, looking back at COVID, and I just say this nicely, but if it had affected children before it had affected seniors, we would have a lot more attention paid to it.
True.
So,
For those that qualify, do we provide MMR vaccinations? And then in regards to surveillance, like you mentioned Collinsville and DeKalb, we're a border county. Do we
Right, Joyce,
monitor what's going on north?
We do, we would get notification. I think Winnebago had put out messaging regarding a student that had gotten infected in Wisconsin through the university system, but that they had not seen a case. So I will see stuff that happens in Wisconsin. I understand we're quite close to the border and it does matter.
Okay, well, we do have that access. Okay, good.
And I was wondering, because I'm licensed in every state for my job, and so I get these notifications. So in Utah, there's been some clinical staff that has been now positive for measles because of the exposure, and they are recommending, well, in Utah, like, for that people in the field to get revaccinated. I don't know if that's something that we would want our staff that are in front of like patients to get, if they're to just get a booster, recommend a booster for our staff.
If they're not immune.
Yeah, I mean, these are just people like us, we got, our measles, we're all up to date, but then.
Did they have the titers like
That's what I was
double?
gonna ask, yeah.
I don't know, I sure I have the email.
Yeah, all
I can't remember.
clinical personnel, if you have a clinical role, you should be getting titers at the time of employment.
Oh, great.
And if you are immune, great. If not, then you gotta get your booster.
Oh, okay, all right.
Kind of follow, I know we talked about immune or vaccines for our employees previously. What sort of follow, if somebody's here, Angie's been here a tremendous time, that's great. If you're here 25 years, are we double checking it anymore?
The titers are good for us.
Yeah, you should be fine. You don't have to recheck it.
Okay.
As long as an adult, you responded to the childhood vaccine, you were able to maintain it. So you should be fine.
Okay, cool.
Unless you're reading, you have to get it 3 times, and then you're finally immune.
Let's double check that.
Okay.
I mean, people can be swayed to change it pretty easily. Like, I had a family that came in to the urgent care and the baby had a rash on its head, and so I made a big production out of it. I said, get them back in the room right away, and shut the door. I said, you cannot come out of the room. And I called the health department and everything, and then, the health department's like, no, it's not measles. And, but just all that,
Scare.
to do, they were like, I was like, so just, we do recommend you getting vaccinated. Oh, no, we're going one day and getting it. Oh, great.
That's good.
A person that seeks medical treatment, whether it be through an urgent care or their family physician or an emergency room, et cetera, and it turns out to be measles, that's where we find out about it, because it's a mandatory report it. They're not gonna come to us.
The lab
with-
reports to us positives, and anytime that they send for testing, they're supposed to call us so that we get an IDPH lab number to associate with that sample that gets sent, presuming that if it was suspect measles, yes.
So anybody coming into any of our clinics or ED, if there was, would get escalated through infection prevention. They will let the county know, and they'll let the state IDPH know as well, and obtain, so there's a written out protocol for all of that they have to follow.
Great. So it's good teamwork between.
Yeah.
They take it very
Sarah and us.
seriously, they take it very
Right, yeah.
seriously, and contact tracing very seriously also, because there are, in certain areas, many people who aren't immunized, and then therefore are.
When there's
at
one,
risk.
there's usually many.
Right.
Yeah.
Mm-hmm.
Yeah, and they'll call you back on a Sunday in a half an hour. Yeah.
Okay, good to know. Any further? Thank you.
Thank you.
The next item on the agenda is consent agenda. In regards to that, item 6D2, the TV medical director, 2026 through 2028 independent contractor. I'm going to remove that from the consent agenda to be
We need to update the language.
acted upon at a later date.
Yep, it'll come back to you next month.
Okay. Anybody else have an item to remove from the consent agenda?
I make a motion to approve the consent agenda.
Second.
Minus 6D2.
Minus 6D2, thank you.
Yes. A motion has been made by Ms. Gaffney, seconded by Mr. Markison, to approve the consent agenda, apps with minus 6D2. As this is has some monetary issues, we'll do a roll call vote, please. And wait, any discussion? Okay, a roll call vote, please. Barry?
Ms. Lawson? Yes. Dr. Hepis?
Yes.
Ms. Hollyfield?
Yes.
Ms. Gaffney?
Yes.
Ms. Altough?
Yes.
Mr. Markison?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes. The majority voted in favor, motion passes. Next item is contracts and agreements. 7A, McHenry School District 15 Memorandum of Understanding. Someone from staff want to speak?
Sure. We put together a memo of understanding to provide an on-campus immunization clinic. So that'll our nursing division staff and team members with District 15. We'll do it on our mobile clinic on site.
And it's with existing staff and such, so there's no additional cost.
Correct.
Okay.
I was just curious with because it was like 2 school districts, did you guys target these school districts or were these the only ones that responded yes?
Some reach out to us specifically. There are areas that I would like to reach. It's definitely on our list. I mean, to be clear, the mobile clinic coordinator has a map on her, right next to her desk. She's an extraordinarily organized woman and she has a whole map and she's got targets on each of there and she knows where she's going and she knows where she wants to be. And we've had conversations about it. So it's definitely on our radar to spread ourselves to areas that we haven't yet reached.
Awesome. Okay.
Motion for approval?
I make a motion to approve the McHenry School District 15 MOU.
Second.
The motion has been made by Ms. Gaffney, seconded by Ms. Altough. Any further discussion?
A couple questions. So this is at a high school, right?
15 is the grade school.
15, I'm so sorry.
He
It's
would
like,
know
oh,
that, yeah.
not my town, or my bad. Did not grow up in McHenry County. So this is primarily aimed at children who are Medicaid underinsured, uninsured. And then in those cases, so the mobile clinic arrives or the parents would.
The school nurse is generally working with us to put out messaging in advance and they know like what kids need immunizations also for their school.
Okay.
So there's messaging going out for them to enroll. We've tried to do mixed events where we do pre-registration and walk-in so that you have both options. I like to try and make sure that we have people that are registered. I've had events where we had people registered, no one showed up that was registered and we had walk-ins. You really can't, it is dependent on the location, the timing, there are many factors. So we try to do both.
So, and I apologize, I might have missed it in here.
No.
Does this occur during the school day?
No, we've done it after school hours during the summer. We've done them weekends. So we try to do hours that meet the needs of the parents and children. A lot of parents can't get off work to do shots.
Got it.
During the day.
Right, yeah, no, this is great. This is a great resource. Okay, thank you. You answered my other questions even. Thank you.
You're welcome. Thank you.
In regards to McHenry School District 15 Memorandum of Understanding, we can do a voice vote. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it, motion passes. Next item is 7B, Nipper Public Library. Same.
I'll make a motion to approve the, Nipper Public Library District Memorandum of Understanding.
Second.
Okay, any questions from the board? Hearing seeing none. Motion's been made by Ms. Altough, second by Ms. Gaffney. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it, and the motion passes. 7C, Johnsburg Public Library.
I make a motion to approve the Johnsburg Public Library Memorandum of Understanding.
I second it.
You got it.
Motion's been made by Mr. Markison, seconded by Ms. Hollyfield. Any questions or comments from the board? Hearing seeing none. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it, motion passed. Okay, McHenry County Department of Health Annual Report for review and approval.
make a motion to approve the McHenry County Department of Health Annual Report.
Second.
And well done.
A motion has been made by Mr. Markison, seconded by Ms. Gaffney, to approve the annual report from the McHenry County Department of Health. Would you care to comment on the?
I would like to thank all the directors, for their contributions, and thank Nick Kubiak, who is our PIO. He's the one that has compiled this. He's done a great job the last few years, since he's been here. I think it looks great, and if anybody ever has any suggestions of what you'd like to see in there, we're open to including that going forward.
I think he does a great job too. He really does.
Mhm.
It's easy to read, it's well displayed, it's really,
Lots of pictures.
and then again, just
Catches
for
your
the,
attention.
Got animals.
just
I
for
know we've
the,
already been
Funny.
invited, or someone who has the power to schedule us on the agenda for the cow has
Someone in a plaid
begun that
shirt sitting on
process,
right
yes.
here.
Well, we did PHCS. So that's
First.
First, yeah.
And penciled in. We have
Penciled in.
CMAP housing readiness, that day too, so. But that's April 2nd will be the PHCS meeting, 8:30.
Question for you on the whole report. So that was annual report for 2025.
Yes.
And in it, I just want to draw this out because what we just talked about, the findings about, we have findings in there about breast and cervical cancer screenings, which are outstanding, exactly what I talked about, but I was just asking for like a little bit more, urgency, I guess. On there, I mean, if I understand this month's, we've already surpassed last year's in some of these cases. I mean, it's.
I'd like it better if it was in May too. I'm sorry, go ahead.
Sure.
I'm sorry.
I was just saying, for all of 2025, breast cancer is diagnosed 4, right? And then for February,
We've had a lot more than normal. I brought that up in February, that we've seen more
That's amazing.
more diagnoses than we have previously.
so really, it was almost maybe like double take that, like, oh wait, was this a pre-report? No, this is all last year, so really, really good. Thanks, and then you want it in May?
I would
Like on the
prefer
fiscal
it.
year?
I'm gone in April. I prefer if we put it on. But it's up to you guys. Sometimes
you're talking about presenting
sometimes that can be a hindrance.
No. If we can accommodate our schedule, that would be.
Well, it certainly can. All right.
I'm the marketing team.
Just let me know.
So let me pull up the date, just so everybody knows, we're gonna do it in May. Let me back. So the county board meeting will be on the 19th. That means 14/7, you're looking at, so April 30th would be PHCS.
It's even better.
And the cow will be when?
And the cow will be May 14th.
If I don't do it here, I don't.
Yeah, I'm doing the same thing. PHCS meets in the morning, right?
8:30 is correct.
8:30.
And the cow is at
So it'll
9.
be the cows in the morning too.
The cow is at 9 o'clock, yes.
Oh, is it night? What?
Cow is at 9. committees
Oh,
are
at 9.
8:30.
I'm sorry, I thought you said at night.
And then you said the cow is May 14th?
14th, Thursday.
Cool, that's at 9, got it.
And so, Cliff, so you'd like it to go to both, correct?
That's what we,
Yes.
we did that last year.
Yes. No, we didn't do it last time. It was
Well,
the
we
first
went to,
time.
well, we just went to the cow.
We just went to the cow. But I think it'll be more of a table discussion at the committee level.
You might get into more of the specifics that you were talking about breast cancer and what's happening with measles and what's happening with personnel at animal control. We can talk about those things. And watching the grants.
Cool.
So you know.
The,
Could move another baseball game.
Good.
Public safety committee meeting is what?
Public health committee, that'll be April 30th. And that'll be 8:30.
Okay. Thank you.
I want them to get sick of you.
Yeah, I will. Okay, a motion has been put on the table by Mr. Markinson, seconded by Ms. Gaffney, to approve the McHenry County Department Annual Report. All those in favor signify by aye.
Aye.
Opposed, say nay. I have it. Motion passes and the report is adopted. Does any board members have any issues that they wish to discuss?
Mr. Chairman? Just to follow up to the 60th anniversary, and I want to tie it into our monthly recognitions. We are doing a public health person of the month, and we would like public hero, health hero. We've got quite a few nominations in, and it's going to be spread out over the year. But we had a discussion, it's more impactful to show up to the person's workplace, recognize them there with a representative from the county board possibly and from the Board of Health. And I'd like to also extend that to these monthly things, because I don't think, I mean, it's nice for us to read about someone 25 years, but I think it's really impactful if we show up at their workplace and say thank you very much. So I'm happy to put together a list of availability for people to show up at the, and I'll give it to you, at the upcoming presentations and where they're gonna be.
I like the idea. Anybody else want to comment?
I'll share that with the chairman too. He'd like to do that. He likes that.
I'm in.
Well, you go there all the time.
And we said we'll make sure that the person's there when you're.
Yeah, exactly.
Also name tags.
And the name tags, we'll have name tags for everybody at the ribbon cutting ceremony. We're just having donuts and coffee. I got everybody's money except for a couple people, and Carolyn and I will be picking the coffee and donuts up in the morning.
We'll pick up the 5 gallons.
Thank you.
Anybody
Let's go.
wanting a
Good
sign
idea.
that says donuts not paid for by taxpayer dollars?
Yeah.
Yes, with sprinkles.
But be sure to wear them on your right side, because as you go forward to shake hands with someone, your name tag goes forward.
She knows
Just
that.
as
I learned that. Did anybody ever hear that?
No.
No.
The politician hears that all the time.
Yep.
Do you hear it?
In sales, you say it all the time. Put your hand forward, your name tag goes forward. Because if you're doing this and your name tag's back here, they're like,
I thought you just do it here
It
because you're
also allows the
right-handed.
person who doesn't remember who the heck you are, but knows that they should know who you are,
Right.
to read it without staring.
Right.
I'm
Yeah.
guilty.
So am I, all the time.
They won't be fancy, but.
The ribbon cutting is at
9. 9, it goes 9 till noon, so it's like the ribbon cutting and then people can.
Yeah,
go to a
and
meeting.
I think we're gonna set up in the old new conference room with the donuts and everything.
And we won't hang anything on the walls.
I thought they were.
Nope. It's a last name. We don't want to chance it. They were trying different things to put with all the nice bulletins through the years, through the decades.
I trust all of you. I was thinking of the tours, attending the opening at NAMI. It was jammed, and so there wasn't, are you thinking about that? Is it self-directed tours and you're gonna have people
There will be
in rooms?
people,
Okay.
in all the different areas, because it's a huge building to walk through the
Right,
different hallways and
right,
everything, and
right.
not end up in somebody's
But-
office.
Yeah.
It's a remarkable job what they did at the building.
Yeah.
Worth seeing.
I got to see
And then I
that.
think what the plan, I think the plan
The
also,
garage, I noticed the garage.
Storage.
I think the plan was also to park the bus in an area where people can walk through that and see what that is as well.
Are they okay with that?
Because they have the
You need a motion for executive?
Yeah.
Oh, I just- I have one.
There's lots.
Okay, go ahead.
Oh,
There'll be someone sitting.
Valley High
So they can
won
see it.
awards last weekend. Yes, they did, from the Environmental Defenders. They are our government award winner this year for doing, they are composting at Valley High, and it's going really well. They worked a lot with Kim Hankins at MCC to establish that, and we might be doing it at the jail as well, right?
That was a good pilot program, good reviews. We talked to the sheriff and he's interested in expanding it, so.
Yeah.
Cool. Groovy, nice job.
So it's a parade, so.
Very good. Congratulations. In your board packet is the appendix with all the reports from the different departments, including the strategic plan progress report. Next item is number 12 on the agenda, go into executive session.
I'll make a motion to go to executive session
I second it.
for 5 ILCS 120/2 C11 pending litigation.
I'll second it.
Thank
I had
you,
to take
thank you,
more.
thank you, thank you.
Any discussion?
Thank you, you guys. Have a nice evening. Drive home safe. Watch out for the
invited to
snow.
Motion's been made by Mr. Markinson, seconded by Ms.
It's chocolate.
Hollyfield
It's a chocolate. It might.
to enter executive session.